So what we did in the lumbar, remember we did central PAs in the lumbar. So the same thing we can do in sort of more thoracic spine as well. So just apply a bit of a pressure, even though it looks for the larger surface area, but you know, we do the best we can. I just apply, said, how does that feel? Is that sort of similar to your pain? Or maybe another level? So kind of just doing that PA through the spinous processes. Okay, good. Next one. Okay, so that would be central PA. Now for the transverse process, maybe again, maybe I'll get a pen. So if you want to, you can sort of look at the transverse process as well. So from the spinous process, you drop sort of in that gap. Can you see this is a muscle, but from the spinous into that hollow area almost. So that's a gap. And in that gap will be transverse process. So you can apply a bit of a pressure through the transverse process. Yeah, because if you see then, it's gonna be sort of more muscular spinous process here. So you drop immediately, so the level above, that will be transverse process. Okay. So apply the PA, what we did in the lumbar, same thing. So okay, how does that feel? Let's say compared to this. Compared to this, and then also go on the other side. Now, pain provocation, like if it's painful, just double check if it's not from a pressure. If it's from a pressure, that's irrelevant, isn't it? Because if you push hard enough, it can be painful, but looking for that, there's similar pain reproduction, okay? Yeah, so that's that. And then also come a bit more laterally, and you can see, you can even feel ribs. So we're gonna be sort of more on the angle of the ribs. So how far? Depending on the patient size, but maybe another sort of 2 thumbs and you will be on the angle of the ribs. So you can apply a bit of pressure through that angle of the ribs. Okay, looking for that pain.
So there's a PA pressure right on that rib?
Yeah, just on the rib. Yeah, especially they say, look, the pain is around this sort of this area, so you kind of probably it's not your fascia, probably it's not your spinous process. So apply that. Now also you could do hook the thumb under on the side of the spinous process and then apply a bit of a transverse pressure. So pushing the spinous process across. Okay? So that's a transverse pressure, looking for that symptoms. Okay? Usually they are uncomfortable these tests anyway, but looking for again symptomatic level. So one and then that way. So if the spine is proceeding here, so you're pushing that way or that way. So it's a transverse pressure. Where's the spine, guys? Spine. Good. Yeah. So that looks like hook, and then push across. So we did central PAs. We did PA on the transverse. Then PA on the rib, and then hook and push that across. That's transverse process. Transverse process. So not transverse, spinous process across. Transverse pressure, not transverse process. And you can do it other way, that way as well. Okay? Any guys questions on that? They're quite easy tests. But just again, quite be gentle, especially with some sensitivity on the spine. So let each other know if it's too painful. Okay. Now we've got also where is a rib angle in between your medial border of the scapula and thoracic spine here. You got also dorsal scapular nerve. So just be careful that you're not pushing hard on that nerve. So more on the bony element, not on the nerve. We'll talk about nerves a bit later. Because sometimes you can really mope someone and they said, look, you know, after that I was in pain for 3 days, so it's still painful, it's burning. Probably because you really compress that nerve. So it's kind of need to be gentle with this, because here you've got quite thick nerve, dorsal scapular nerve. So when you look at the nerves, you will see the anatomy of it. So just be mindful of that nerve. So palpate the nerve maybe, and then go either medial or lateral to it. But yeah, we'll show it later.
In this position, can we also mop the ribs?
Yeah, so treatment can follow, yeah. We can, I'll show you, but at the moment just still assessing, but definitely we can use